The treatments for diabetic neuropathy depend on the type of neuropathy if you have. If you have the most typical, which is diabetic peripheral neuropathy, the discomfort in your feet, your legs, or your hands, there are a number of possible treatments. First of all, for all types of diabetic neuropathy, the number one treatment is to control blood sugar levels. After that, we encourage patients that are smoking to stop. We encourage those individuals that drink alcohol to stop alcohol consumption altogether. Improving blood pressure and blood cholesterol levels will help. And then we turn to different drug therapies. And at this time, there are a number of potential drugs to treat painful diabetic neuropathy. And those agents include drugs such as gabapentin, which has a very wide dosage range. We can treat patients anywhere from 300 milligrams a day to 3,600 milligrams a day. That drug allows us to titrate the dose very specifically to the patient's needs. The side effects of gabapentin are that it takes up to 3 weeks to see some relief in peripheral neuropathy pain, and also kind of unpleasant side effect profile, including dizziness, lightheadedness, and some nausea. But it is a useful agent, usually considered as the first drug treatment for painful neuropathy. If gabapentin fails or the patient doesn't tolerate the side effect profile, there's a cousin drug called pregabalin. You all may have seen the ads on TV for Lyrica. That is a relative of gabapentin that has a similar mechanism of action, but a better side effect profile, a much lower incidence of sedation, of fatigue and nausea, and it more quickly relieves the pain in patients' feet or their hands. So it's a very reasonable treatment option for those individuals that fail gabapentin. An interesting side effect of Lyrica that doesn't appear to be as common in patients treated with gabapentin is pretty remarkable weight gain, especially in women with diabetes that have been on pregabalin for a significant period of time. So another option to treat painful neuropathy. Other drugs include antidepressants. Cymbalta or duloxetine has actually been approved by the Food and Drug Administration for use in diabetic patients with painful neuropathy. It's an antidepressant and is an especially good choice for your physician to prescribe if you also have some issues with depression as well as painful neuropathy. And Cymbalta or duloxetine is very effective in relieving diabetic peripheral neuropathy pain. Other treatments include some anticonvulsants or seizure medications, such as Tegretol, which is a very old drug, has been very effective in treating painful peripheral neuropathy, as well as some of the older antidepressants, such as amitriptyline or Elavil. In a very low dose is effective in relieving diabetic peripheral neuropathy pain. I just needed to mention that in terms of pain medications, we don't usually recommend that diabetic patients be given pain medications for peripheral neuropathy because this is a chronic condition. And if we treat the disorder within 6 months of onset of the pain, there's a very good prognosis for relief of the pain. So we don't usually use pain medications such as Vicodin for treating painful peripheral neuropathy.